There's a drug out there in the medical world that's a real paradox. On one hand, it can soothe nausea, stop an allergic reaction cold, and even help sedate a patient. But on the other hand, it carries warnings so serious, they demand our full and complete attention. Today, we're looking at the two faces of promethazine.
So let me just ask you a question. What could possibly connect that queasy feeling you get on a roller coaster, the need to be calm before surgery, and a sudden itchy rash from an allergic reaction? I mean, on the surface, they seem totally unrelated, right? Well, believe it or not, there's one single, surprisingly versatile medication that can handle all of them. So let's dive right in. We're going to break down how one drug can possibly do so much and why that very power means it has to be handled with incredible respect.
All right, so to really get a handle on all the different jobs promethazine does, we first have to pop the hood and see what it's actually doing to our body's chemistry.
Okay, so at its core, promethazine is what's called an H1 receptor antagonist. Now, I know that sounds super technical, but the idea behind it is actually pretty simple. The analogy here, the key breaking off in a lock, is just perfect.
Let's break this down. Your body has all these tiny locks called H1 receptors. When a chemical called histamine, the key, fits into that lock, it triggers all those lovely allergy symptoms like itching and swelling. While promethazine is basically a blocker. It swoops in, gets to that lock first, and essentially jams it. So when the real histamine key comes along, there's nowhere for it to go. No key in the lock, no allergic reaction. It's as simple as that.
But here's where it gets really interesting. Blocking histamine, that's just part of the story. This drug is a serious multitasker. It also has a sedative effect. Yep, that's why it makes you drowsy. It has powerful antiemetic activity, which is just the medical term for fighting nausea. And it has anticholinergic effects, which means it can cause things like a dry mouth. It's doing a lot all at once.
So with all those different actions packed into one molecule, you can probably start to see how it could be used in a ton of different medical situations. Let's take a look at what those are.
Because of everything it can do, clinicians see it as a kind of Swiss Army knife. It's a go-to for nausea and vomiting, whether that's from motion sickness or after an operation. It's used for sedation before surgery and even during labor. It can actually make pain medications work better. And of course, it's used for those classic allergic reactions. It's just incredibly useful.
But, every powerful tool has the potential for danger. And this is where the story takes a very serious turn. For all of its benefits, promethazine has a dark side, and it's something we absolutely cannot ignore. This is the other edge of the sword.
It is so important to understand the difference between a side effect and an adverse reaction. A side effect is something you might expect, like feeling drowsy or a bit dizzy. But an adverse reaction, that is a whole different league. We are talking about things like irregular heartbeats, extreme agitation, severe muscle spasms, and even something called massive tissue injury if the drug leaks out of a vein.
And then there's this. This is a direct quote from the official clinical information. Let that sink in for a moment. Use in children may cause hallucinations, convulsions, and sudden death. There is just no way to soften that language. The risks are profound, and this is especially true for children under the age of 2. That's why it is used with extreme caution in pediatrics, if at all.
Because it's such a powerful sedative, there are some really clear, hard and fast rules about who should never, ever receive it. This includes anyone in a coma or someone whose central nervous system is already suppressed by alcohol or narcotics. And of course, if you have a known allergy to the drug itself, it's an absolute no-go. These serious risks are exactly why there are incredibly strict protocols for how this drug is given. This is not something you handle casually. It takes precision and extreme care.
The dosing has to be meticulous. For an adult, you might get a standard dose, say 12.5 to 25 milligrams. But for a child over 2, it's never a standard dose. It has to be calculated very carefully based on their specific weight, with a strict maximum that can't be exceeded.
And these golden rules for giving the drug really tell the whole story of its potency. The preferred way to give it is a deep injection into a muscle, specifically to avoid veins. If you absolutely have to give it intravenously, it must be diluted, and it has to be pushed incredibly slowly. We're talking 10 to 15 minutes for one dose. You have to use a big, safe vein, never a small one. Every single rule is a safeguard built around this drug's potential for harm.
So we're left with this perfect image of a double-edged sword. Promethazine is, without a doubt, an effective and incredibly useful medication that brings relief to so many people. But it is also a substance with the power to cause immense harm if it's misunderstood or misused. It's a perfect reminder that in medicine, sometimes the most powerful tools are the ones that demand the most wisdom to use correctly.